And there's a viral video online. In its tag, it says Illinois State Senator Dave Syverson exposes JB Pritzker for giving over 120,000 illegals free health care, costing taxpayers over $1 billion. They're getting free daycare, housing, food, and cash. I have Illinois State Senator Dave Syverson here joining me now so we can talk about why, why he's calling these things out and where we go from here. So thank you for your time.
Well, my pleasure. Thanks. Thank you.
Absolutely. So tell me about how we got this viral video first and foremost.
Well, I think it's a couple years old. I was trying to look to see when that was posted, but I think that was at the height, which was, a couple of years ago, and of the expansion of the Medicaid program, where it would be covering non-citizens. And at that height, we had over 70,000 enrolled in the core expansion program. Then we had another 50 to 60,000 that were using emergency services, and then not counting other asylum seekers and others that were using healthcare. So at that time, certainly well over 120,000 people using our state's Medicaid system, and at a cost where, like I said, the last 4 years, we've exceeded over $4 billion of taxpayer money being spent at a time when we're struggling to help take care of our veterans and our seniors and our disabled population. So we thought it was important to point out that we just think that was a misplaced priority.
Yeah, so some of this has kind of come full circle in a lot of ways. If you think about the fact that the time period that you're speaking of was when those who were undocumented were being bused or flown from Texas here to Illinois, and the city of Chicago and the state of Illinois were really grappling with how to deal with this influx of people that were being brought here because it was a sanctuary state.
Well, I think it was more than that, because when we changed our law to expand free health care that covered everything for them from ages 42 and older, that word got out, as we were one of the few states that did that. 2 years ago, New York, California, they covered emergency medicine, they covered wellness, but they weren't even covering very sick individuals. So it's not necessarily the individuals that were coming from Texas. It was individuals that were very sick that knew Illinois was the only state that was at that point covering these very sick individuals. So they were obviously working their way to Illinois. And that's where the original estimate of the program was going to be $1 billion, and it turned out to be well in excess of $1 billion for that year in the budget. So that was the concern we had, that we were becoming a magnet for the sickest of non-citizens from across the country.
Yeah, and you mentioned New York. Right before I came up here to Studio 32 for Chicago Live today, I went back and listened to the testimony of Governor Pritzker and Governor Hochul of New York as they were on Capitol Hill. They were testifying before the House Oversight Committee about being sanctuary states. And one of the things that Governor Hochul talked about was the fact that some social service laws allow for these things and some don't, and that none of this is universal. And Governor Pritzker, pretty much said the same, that law-abiding, tax-paying people who add to the economy may not actually be legal citizens and should be afforded these things.
Well, again, there's so many different categories, but as a state, we cover emergency medicine, we cover children already. We cover those who are asylum seekers, and that's like a whole separate category. Mm-hmm. The concern was in the fiscal year 24 and in 25 that we broadened the program, and when you're the only state that's going to cover individuals from ages 42 to 64, regardless of their health conditions, pre-existing conditions, covering you for any health condition. We started seeing a migration of sick individuals or family members transferring and bringing sick individuals into the state. And so the cost of this program exploded much more, I think, than than the administration thought. We knew that if you're going to be the only state covering this population, that of course, who wouldn't try to get their sickest of their relatives into Illinois? And so that's what occurred. And so during that 4-year period, we ended up spending about $4 billion covering healthcare for these non-citizens, and that's not including, that's a separate category than asylum seekers that you were referring to. So now California has added some of that coverage, but it is something that Illinois became a problem because we were a magnet state for the sickest of the sickest. So it's not just taking in non-citizens, but it's taking in the sick ones that were such a burden to the state financially.
Yeah, and so I guess, if you go back to that time period and you listen to interviews of, say, someone from the health department or a doctor, they kind of point to the fact that, well, if there are things like measles outbreaks that we were seeing in some of the centers around here for people who were coming from other countries, does the work or the money not then protect people who are here in Illinois from getting the same things?
Well, it's a good question. The things like vaccines, wellness, those things are all covered regardless. They're covered from health departments, they're covered from federal health clinics. What we're talking about is individuals that were coming here that had heart disease, that had kidney disease, that had cancer from around the state, around the country. You had individuals that had, that were non-citizens that were living in Indiana or Iowa or Kentucky, where their health plan wouldn't cover them. So they came to Illinois because Illinois was the only state covering it. So we're talking about major health issues, which is we're driving up those costs. When we're talking about, like I say, wellness, immunizations, children, that's a whole different category. And those individuals were covered and they're still being covered for the things that you're talking about.
And so you're okay with those?
Those we have to at this point until the federal government ultimately, deals with that issue. We need to have a safer overall population. Now, we were concerned that some of these vaccines, the school districts weren't requiring that of children, non-citizen children coming in. We're just requiring it of our own children, which didn't make sense. But so currently, like I say, children are covered. Pregnant mothers are still covered. Seniors are covered. Emergency care is covered. But what we can't afford to do is be the healthcare provider for anyone who has health issues from around the world that wants to and can make it to Illinois to cover them. We need to take care of our own citizens, our own seniors, our veterans, our disabled. We need to take care of them first before we can afford to be taking care of healthcare needs of people from around the world.
Sure. So, you mentioned the federal government needs to deal with this issue. Let's talk a little bit about that, because in the testimony going back to June before the House Oversight Committee, Governor Pritzker did say it's the federal government's job to decide on a lot of these issues. So is it Governor Pritzker that puts us in this position, or is it the federal government?
Well, it's 100% Governor Pritzker because the federal government made it clear under the Biden administration and under the Trump administration that you don't provide health care for non-citizens, which is why in Illinois, when Governor Pritzker said, we want to be the only state that provides this broad health care, that's why they came here. And that's why it's 100% paid for by Illinois taxpayers. So this was the broadened Medicaid program that was paid for 100% by state dollars. This is not emergency medicine. This is not children, because that's part of the national Medicaid program where all states are covered the same. Illinois was unique. Illinois marketed themselves as being unique, saying, give us your sickest. We'll take them, and we'll make Illinois taxpayers pay for it. And they did. And people took advantage of it, and they came here, and we've spent billions of dollars. And now this year, as you know, the governor retracted that. And so now in Illinois, we no longer cover for age 42 to 64. Those are no longer covered, but unfortunately they're here. So they're now just becoming charity care going into hospitals, which ends up hurting all of us as well. But clearly, we got put into the situation when Illinois opened the door to say, we want to be unique in this country. We want to do something the other states don't do. We want to provide broad health coverage for non-citizens, and cover, even though the federal government doesn't allow it, we're going to cover it with our own tax dollars. And they did. And unfortunately, it led to billions of dollars of Illinois taxpayer monies being used.
Yeah, and there's so many different ways, obviously, that one could look at that. What about the other benefits? I mean, you've focused a lot on healthcare, but in the Post, and I understand it's a little old and maybe recirculated recently, but you also mentioned food and housing and daycare.
Sure. That when we look at the total cost of what Illinois is expending for individuals that are non-citizens coming in, whether it's all the education, housing, healthcare, the criminal justice related costs, it is a significant cost. And at a time when we're meeting with families that have children who are disabled, who are on waiting lists for services, or we're meeting with veterans that are struggling to get care, as a state to be spending this kind of money to be taking care of non-citizens, it really comes down to what is going to be the priority. And as elected officials, our priority is supposed to be to take care of the citizens of Illinois first, and non-citizens, again, need to be addressed either at the federal level, but it's certainly something as a state. It's creating huge pressures on not just our state budget, but certainly local school districts and local municipalities who are having to cover the costs of these individuals, both, like I say, healthcare to housing to other services.
Yeah, some would say it's doing for the least of these.
Well, again, that's the least of these is taking care of our own citizens who are legally here, who are suffering and need help as well. We just, as a state, can't afford to provide the health care for everyone in the world, and we can't afford to provide daycare and housing for anyone in the world that wants to come to Illinois. That's not what states are for, and that's why the federal government needs to get serious about addressing this, because our priority has to be first and foremost to our own citizens, and then we can look at others. But we cannot afford to be the, like I say, the healthcare provider for the world, nor can we provide housing and education and daycare and other services to anyone in the world that wants to come to Illinois.
Sure, funds can only stretch so far. The federal government would say a part of how they're dealing with immigration, and especially when it comes to Illinois, would be Operation Midway Blitz. What are your thoughts on the operation thus far?
Well, certainly there's been, I think, some mistakes made, and it could have been handled, differently. But part of our problem is the Illinois Trust Act, and the fact that local law enforcement officials aren't allowed to work with ICE to help remove the worst of the worst. People who have been convicted of serious crimes that are leaving either county jails or leaving prison, and they're not being turned over to ICE, and they're going back into the communities. And now ICE has to go and hunt these individuals down. Whereas in other states, when convicted criminals are being released from county jails or from the state prisons, they're transferred immediately to ICE to be deported. So Illinois is, again, different from other states, and that's created, I think, a lot of this chaos that didn't need to occur from the very beginning. I think if the state of Illinois had said, we're going to work with ICE to transfer these convicted, these people who had their day in court, these are convicted felons, to work with ICE to remove these convicted felons, as opposed to, releasing them back into the communities where we've heard, unfortunately, a lot of horror stories of these convicted felons who have committed further crimes. So I think that's where I think this could have been handled better, starting, a year ago, working by adjusting the Trust Act to allow law enforcement to work with ICE to take out the worst of the worst.
That is one of the flashpoints, if you will, that we see on a regular basis. We just saw out at Broadview just this morning, what the limits are for local and state law enforcement when it comes to this federal operation. Do you believe that fundamentally the welcoming city ordinance or the sanctuary city laws should be changed as well? You mentioned the Trust Act.
Sure. I mean, we hear from sheriffs constantly their frustration that they said that, we're releasing a multiple convicted felon from our county jail who have served their time, but we're releasing them. These aren't good people, but we're banned from turning them over to ICE. And they're frustrated because they know these individuals are going to go back onto the street and they're going to be committing a crime again, and some innocent family or individual is going to be affected by it. So certainly the sheriffs from across the state are pretty united in the fact that they're frustrated, that they would like to work with ICE to at least remove the worst of the worst. We can deal with the other population issues later, but I think most people are in agreement that convicted sex offenders and drug dealers and murderers and rapists, these individuals should not be in our communities and should be removed. And the sheriffs are frustrated that the state of Illinois doesn't allow the sheriff to do that. So then ICE has to come in and try to track these individuals down that have been released from our county jails.
And so for reports that say of the 3,000 or so people who have been arrested or detained during Operation Midway Blitz, that 70% of those people did not have criminal records, weren't maybe the worst of the worst. You feel that it's because, if the federal agents are going after the worst of the worst and others are kind of swept into that it's a result of that.
That's absolutely correct. And that's what the local sheriffs tell us too. They said, what, if we could turn these convicted felons over to ICE right away, as opposed to they're released back into the neighborhood. So then ICE has to go into that neighborhood and they have to track those individuals down. And while they're tracking those individuals down, they're obviously running into others, either family members or friends that they're running into. And so this wouldn't have happened if we were acting like Wisconsin or Indiana or Iowa or Kentucky or Missouri, where when a person has been convicted and they've served their time, they're turned over to ICE to be deported. I mean, that's a 90% polling issue that people say, no, we don't think a convicted felon should be released back in our neighborhoods. These individuals need to be deported.
Well, State Senator, let me ask you I want to go back to the initial post that got us talking today. Just your thoughts on how a viral video can be recirculated and bring back up an issue that maybe you had already dealt with.
Well, it is interesting. When I got a call today and I had to look and go searching way back to see how long ago it was. And I think that's part of the problem with social media. Mm-hmm. Many times people will open up their posts, whether it's, on Facebook or TikTok or Twitter, they'll open it up and there'll be a story there and say, wow, that's an awfully old story. And obviously someone just reposted it and it gets out there. So this is an old one, but the issue is still here, and it's still a huge budget issue to the state of Illinois because of the lingering effect that even though we have put the program back, the problem is these individuals are here still, they're still sick. So the hospitals and doctors are still serving a lot of these people, but it's charity care at a time when hospitals are all struggling. The ER rooms have long record delays right now. So the lingering effect of what happened the last 4 years is going to be felt for some time here in Illinois.
How do you feel about the federal funding cuts to some of those hospitals that are also weighing on them?
Well, clearly, some of those issues have to be addressed, and it depends on whether it's the downstate or the outstate. And I know they've been talking about the whole issue of safety net hospitals and safety net funding. So it's a very complicated issue, very complicated formulas that are in place. We continue to work with the Hospital Association as well to make sure that we have plans in place to protect the viability and the strength of our local and our rural hospitals so they can continue to serve everyone. But clearly this has put a burden, especially in Illinois, because we have so many that are here that are not covered now. Either again become charity care, or they go to the emergency room and try to get used under emergency coverage because the law still covers non-citizens for emergency room visits. So that's one of the reasons why you see the emergency rooms being so backed up now, because for many non-citizens, that's the only place where they can get care. And so it's, again, a residual problem that we're facing.
State Senator Dave Syverson, a lot of nuanced issues for sure, but I thank you for your time.
My pleasure. Thank you so much for allowing me to talk about it.